Okay, regarding harvesting bone percutaneously or a minimally invasive manner from the pelvis, of course we have the anterior superior iliac spine, and we know that the lateral femoral cutaneous nerve can course just posterior to this, so we want to stay at least 2 finger breadths posterior to the anterior margin of the anterior superior iliac spine. There is the iliac tubercle located anteriorly here, which has a large sort of repository of bone in the right hemipelvis, and that's again at least 2 finger breadths posterior to the anterior margin of the anterior superior iliac spine. We want to be sure that when we enter the iliac crest, that we enter at the proper angle. I'm using the 7mm COREX device to demonstrate harvesting from this location, as this is probably the preferred size of device. The anterior crest is going to be thinner than in the posterior crest. And the entry is going to be not straight anterior posterior with the patient on the table, but is going to angle in a lateral to medial direction with cortical breaching and with harvesting of the cancellous bone from the subcortical repository between the outer and the inner tables. The device has beveled features that will help maintain the device between the 2 tables as long as you do not have too severe an angle. As long as you remain relatively parallel with the tables, this will help center the harvest between the tables. If you're going at an angle which is not parallel with the tables, you're likely to encounter cortical bone almost immediately after penetrating the first cortex, and one can penetrate into the gluteal muscles posteriorly, or if you exaggerate your orientation from lateral to medial, you can penetrate the medial table. But light pressure with rotation should allow you to carefully navigate between the inner and outer tables, and you'll be able to feel the resistance of the cortical bone, and it will also in turn guide the instrument between the 2 tables until you get to a point where the tables are so closely opposed that no additional advancement can occur.